Hi there, I'm Deb Iverson. I'm a nurse practitioner, diabetes educator with Core Medical in Broomfield, Colorado. Today we're going to talk a little about diabetes in pregnancy. Now, obviously, if you already have diabetes, you're going to take that diabetes into the pregnancy with you, but it's so important to have that diabetes under very good control before you even conceive that baby, and I'll tell you why in just a minute. The other way you can develop diabetes in pregnancy is if you've never had diabetes before, but you develop it in the pregnancy. That's what we refer to as gestational diabetes. Now, gestational diabetes is kind of common with 200,000 cases per year in the US, which makes up about 6 to 8% of all pregnancies. So, who's at more risk? Women over the age of 25, and we know that, more women are waiting till older ages to have babies. If your body weight is overweight or obese, so a BMI of over 25 or over 30, if you have a family member with diabetes, because genetically that puts you more at risk. If you're one of the minority ethnic groups, African American, Hispanic, Native American, Indian, Asian persons, they're at more risk, unfortunately, for type 2 diabetes. If you've had higher blood sugars in the past, if you've had gestational diabetes in past pregnancies, and if you've had a baby over 8.5 pounds, that's all risk factors for you to develop diabetes in pregnancy or gestational diabetes. So, why does this even happen? Well, when you get pregnant, the placenta starts forming, and the placenta puts off hormones to help the baby grow. But unfortunately, these hormones have a negative effect on some moms that make them more resistant to the insulin that their body is making. So your body is making insulin, but your body isn't using it correctly. And as the baby grows, the blood sugars go up, 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 up. And by about 26 weeks, the blood sugars peak. And that's when all women will have a blood sugar test where you drink a sugary liquid and then we check your blood sugar 2 hours later to see if your body is keeping up with that sugar. If you don't keep up with it, then you have gestational diabetes. So, what are the risks? Mom has risk and baby has risks during this condition. Premature births can happen. Moms are more prone to preeclampsia, eclampsia, where the blood sugars or blood pressures go through the roof, and we have to monitor moms really closely. Moms can be more prone to birth trauma, like tears and stuff like that, because the kids are usually bigger than normal if they're not controlled well. Moms can have more C-sections with these babies, and then of course that leads to prolonged healing, more pain, more postpartum depression, problems with breastfeeding, things like that. Now for the babies, they can have birth injuries, a lot of shoulder injuries as they're trying to come down that birth canal because they're bigger babies. They can have hypoglycemia after the birth. They can have jaundice more often. They spend 3 times more often in the NICU or the newborn intensive care unit, these babies, and they can have 30% more cardiac defects and 20% more neurological defects. So I'm not trying to paint a horrible picture here, but if you get diabetes in pregnancy, or if you have diabetes and get pregnant, it's a must that you have to keep these blood sugars under really tight control. And it's to avoid all these complications. So, how do we do that? Well, first of all, in all diabetes, diet, exercise, and keeping your body weight as normal as possible is always number one. So we've all heard pregnant women say, well, I'm eating for two. I can have two of that and two of that and an extra serving of that. That's so not true. A pregnant woman only needs 300 calories to support the growth of a baby. Now, a peanut butter sandwich is almost 300 calories, so it doesn't take much to, put in 300 more calories a day without even thinking about it. So a meal plan and making sure that it's a healthy diet with all 4 food groups is really, really important. The other thing is we'll give you a glucose meter and you must check your blood sugars and they must fall within certain ranges. The other treatment is insulin. Now, insulin is the crux of the problem. You're either not making enough of it or your body isn't using it. So 20% of women will have to be on insulin during this stage. And sometimes they'll start out with 10 or 15 units a day, but at the end of the pregnancy, it may be 50 units a day. It just depends what your body needs as that baby grows, because it's going to need more as that baby grows. Also, people with gestational diabetes can be more prone to develop diabetes after the pregnancy. So at your 6 weeks postpartum visit, you should be tested for diabetes to make sure that your blood sugars have returned to normal. If they haven't, diet and exercise, of course, but there's also medications that we can start to prevent the onset of diabetes. And then 1 to 3 years later, you should have your diabetes numbers checked again to make sure that you aren't developing type 2 diabetes afterwards. So I hope this has been helpful. Let me know if you have any questions. You can always schedule a virtual visit with myself or one of the other nurse practitioners, and I hope you have a great day. Thanks.